If you get a sore, achy back when you stand for long periods of time or just walk slowly around the shops, and it always makes you feel like you want to stretch forward and round out your lower back to relieve it, here's what's causing your back pain and 2 exercises to fix it for good. Back pain while standing usually comes from having too much of an arch in your lower back. The weight of your body in the upright position increases the arch, compressing the spinal joints. And this is what creates that desire to bend forward and round out your back to relieve that pain. A very common cause of too much arch in your lower back is a tight rectus femoris muscle in your thigh. It attaches here at the front of the pelvis and it pulls the front of the pelvis down, increasing that arch. To test your rectus femoris, lie face down on a firm surface and pull your foot towards your pelvis. Your heel should be able to easily touch your pelvis. If it doesn't, you have a tight rectus femoris. If you only get to here, this would be moderately tight, and this would be a severely tight rectus femoris. To stretch this muscle, pull your foot up until you feel a slight stretch at the front of your thigh, and then push your pelvis into the floor. You should notice it stretching more at the front of your thigh when you push your pelvis forward. Hold that position for 20 to 30 seconds, twice on each leg daily. Don't lift your chest off the ground while stretching though, as this compresses the lower back joints. If you can't reach your foot, use a towel to help to begin with. If your rectus femoris is really tight, before you stretch, sit down and press in this area in the upper part of the muscle and look for tender points. If you find some really tender spots, rub them or press them for 30 seconds on each side before doing the stretches to reduce any muscle knots that are tightening the muscle. The rectus femoris gets tight if you do a lot of leg exercises like squats, running or cycling, so always make sure that you do this stretch after a leg workout. The psoas muscle is another hip flexor that can increase the arch of the lower back, so it can cause pain while standing too. To test your psoas muscles, place one knee on a cushion or a folded towel, place your legs in a square-shaped position like this, and then tighten your abs and squeeze your glutes to tilt the top of your pelvis back. If that feels really tight at the front of your upper thigh, hold that tilted back pelvic position for 20 to 30 seconds, twice on each side daily to stretch your psoas muscles. Both of these hip flexors can become short and tight if we do a lot of sitting. Sitting shortens the hip flexors. So if you do a lot of sitting, make sure that you do a hip flexor stretch at the end of each day.